I'm curious what you would tell those folks that have left or that are thinking about leaving that would be important from your perspective for them to know.
So get help, whatever that looks like, is the first thing. So is that do you need some counseling? Do you need a coach? Is it a friend? Talk to somebody about what might be going on for you.
Welcome to Safe Space Made Simple, a practical podcast that guides clinical leaders and healthcare managers to create trust and support with their teams. I'm your host, Trace Hobson. Join me for weekly interviews, practical tools, and inspiring transformational stories of bringing people together in healthcare. Now, let's dive in. Hi, everybody. Welcome to Safe Space Made Simple. My name is Trace Hobson. I'm your guide here, and I'm just incredibly excited to have Suzanne Fox of Foxton Consulting as my guest on this week's podcast. Suzanne has an extensive career in healthcare management, leadership, and executive leadership. And she shares today on the podcast what her perspectives are around creating a psychologically and neurobiologically safe space for teams, for leaders, and how what kind of an environment do we need to create so that we can shift the system in healthcare? So I'm excited to share this with you and I'm looking forward to what you think about it. So without further ado, let's get right into it. All right, Suzanne, I am so excited to have you on the show and just really would love to speak with you about a whole bunch of stuff. But let's start off with, if you could share, the work that you do in the world and what you love about the work that you're doing.
Yeah, 100%. Thanks for having me. I'm happy to share some of my story and why I'm where I am now. So currently, as it stands, I'm the founder and principal of Foxton Consulting, where I am an executive coach for all types of leaders and also do leadership development and facilitation, all towards the goal of supporting leaders and people, human beings, to improve their lives. So for me, that comes from a place of supporting people to understand their values and really get clear on those. I think we've kind of forgotten about those in the busyness we see in the world today. So that is a real big passion of mine. You will likely know I'm a healthcare leader. I'm a registered nurse by background, which I hold very dearly. It has taught me many, many lessons. And I've been very fortunate enough to lead many teams in the system across the province at very senior levels in order to soar and to see their patients, clients, customers in a way that allows us to improve the service that we provide as healthcare
Mm,
leaders.
mm,
And so this side now, I've decided that the best use of my skill set is actually to support leaders to stay in the game.
mm. Thank you for that. I appreciate that because that's one of the reasons why I'm doing the work I'm doing as well. Because if there's nobody there to help the helpers, we're in real trouble in healthcare, obviously. So I was looking at your LinkedIn profile and I noticed that you call yourself a resilience architect, optimist, and disruptor of the status quo.
Hmm.
Share what it is that you're disrupting and what you're enjoying about that disruption.
Yeah, I think well, yeah, I'm smiling inside because I think the people that normally would go, "Oh yeah, there's a disruptor." And I like to say that from a positive perspective. I feel like we
Hmm.
get stuck very quickly in the systems and in life that we work in. So I'm always wanting to agitate myself as well as those around me in order to see that there could be better or different ways to do things that allow fresh perspectives.
Right.
So I really like to disrupt the status quo because I think when we get in the status quo, we get stuck. So how do I, as a leader, share the years and years, decades, unfortunately, of experience I have in leadership? And all of that was done by just disrupting and pushing boundaries enough to help people find new ways to do things and actually find satisfaction and improve either themselves and or the system they're working in.
Hmm. One of the things that I notice in working in healthcare, and I haven't been in healthcare as long as you have, I've been working in healthcare about 8 years, starting in Holland and then working here in Canada. And I noticed this predominant pattern in the way that the departments are. There's the frontline point of care, then there's a clinical leadership team that's working to support that frontline, and then there's the manager or leader who is supporting the clinical team. Then you go to the director, and then you go to the ED or the executive director. And in between all those roles, there's these big gaps between that role and the point of care, the patient. And so I'm curious about what you notice about that, and what we need to do to close those gaps, because they create all kinds of different challenges that go along with, people on the point of care feeling isolated or alone, clinical leaders looking around for support and not feeling like they always have it. And then as you go further and further out, oftentimes executives can be kind of flying around at 10,000 feet and lose touch with the humanity of what's going on the ground. And so I'm curious what you think about that, and how you might close those gaps from your perspective.
Yeah, what a great question, and what a complex question.
Yeah.
Because, we can't actually get to the right solutions if we're not having communication with all levels of the organization. We need all levels of organizations, especially in healthcare and the complexity. And that's really, really hard when the jobs are massive and there's multiple teams, to get to a place where you can actually be at a very high level in an organization and still stay connected to the front. So
Right.
sometimes it's about seeing the different perspectives. Do the higher levels actually need to understand at the front level, or do the higher levels need to let go of the boundaries a little bit and allow the next level down, or to actually iterate and make changes that they see need to happen in the front, or on the what I would say direct care platform. So I'm not sure it's a closing of the gap. Part of me thinks we need to open that perspective a little bit and allow people some more um, opportunity to try. And what we talk about all the time is fail. We're in a system in the healthcare right now where I think there's a lot of boundaries, there's a lot of stuff that doesn't allow people to feel like they can shift and move. And I think that's that disruptor in me. We need to be able to allow that to happen. So when you and I talked about me coming on the podcast, one of the things I was thinking about was I feel like as a leader, I've really had success at allowing my teams to soar.
Hmm.
Very quickly can I build trust, and that is because I let them go. I set up the boundaries that we know we can work in, but I set up a very clear vision of the why we're here and the work we're doing. And if we can do that as leaders, and the teams understand the why, but they have some flexibility to move, really great things can happen if you get out of the way as a leader. So when you
I
say close the gap, the disruptor in me says, what if we opened it a little more?
Yeah, I love that distinction. That's so the great juxtaposition there, to open the gap. And what I hear and what you're sharing is this idea of relational equity that gets created in that gap. So we're not maybe closing it, and that then we are freeing people to show up, to be responsible, to take leadership themselves, and to sort of get out of the way, like you're saying. So what are some of the things that you did, especially as you're coming at it from sort of an executive director role or a director role, to foster that environment where you can have that kind of relational equity with your direct reports? And then how do you replicate that so your direct reports are doing the same thing as they go down through the system?
Yeah, great question. And I was fortunate enough to do this a few times in my career, both as a manager on the island, as a director on the island, as an executive director on the island in a couple portfolios, Fraser Health, and also as a VP interim at Fraser Health. I'm a real big believer in the leadership team needs to understand where we're going, but we have to do that together.
Hmm.
So as an example, when I was the executive director for long-term care and assisted living at Fraser Health, it was a really important step for me to take the team through COVID, which I'll just back up. I started 2 weeks before wave two. So there was a lot of chaos, as you can imagine, and
Hmm.
needing to get the team solid and resourced for what was coming towards us. which in the unknowns and in the uncertainties of the world was very difficult. But
Hmm.
at the same time, I felt this responsibility with the colleague I was working with, Dr. Akbar Mathani, that we actually needed to give the team some future focused work because we knew we wouldn't be in that forever. We didn't know how long, but
Hmm.
we needed to have some form of getting people excited and focused on future to allow that. I like to call it kind of speed one, speed two work. So, speed one is that day to day, you got to do that. But what's the speed two? Where's that innovation and the excitement that we want to have that's going to
Mm.
keep us focused on the good things
Nice.
and getting us out of the day to day kind of detailed stuff?
Mm.
So we launched forward with it to do a strategy which allowed the teams and our customers, multiple our affiliated partners, our patients, our clients, families to come to the table with us and help us build a strategy that would support the program in the long term. So I think it's important for leaders to get out of the day to day, get out of speed one and take speed two and use that to keep people future focused, and there is something better and we can move towards something, and we can always shift, but
Hmm.
let's talk about where we need to go, where we think we need to go.
Hmm.
And I really believe strongly when you can support the teams to do that, the next layer, the next level, um, understands that well enough that that just automatically happens to the next level because
Hmm.
everybody knows where you're headed.
Hmm.
um, I make it sound fairly easy probably in this conversation. It takes a little bit of work,
Yep.
and it takes, what I would say is a lot of intention to 20% of the time stay in speed two into the future.
Right. Yeah, I
So
love what you're
I
saying, but
hope that answers your question.
no, I think that's a great answer. And it kind of the speed one, speed two idea with speed two being the innovative flywheel that keeps us engaged with speed one. So, yeah, I think that that's a really great metaphor. Um, I also am curious about inside of that, when you're as a leader developing that kind of intention and that focus. I'm curious about how coaching began to inform your leadership and get integrated with your practice as a leader as well, because obviously now you're consulting and coaching as an external. So I'm assuming, correct me if I'm wrong, that at some point coaching came into your practice as an executive or as a leader. So tell me about that and how that helps to develop that flywheel.
Yeah, I think as a registered nurse, we're always coaching families and each other and our teams and our patients to do better to help, get their lungs moving, deep breathing and coughing. Like there is things in my life that have been carving a path for me that I probably didn't identify, I'll say till about 10 years ago, that I have a passion and a desire to help people improve their lives
Hmm.
professionally and personally. And, I haven't always been in the space I'm in now, which is grateful every minute of every day that I have, and having to do a lot of work on myself in order to get to that place while I'm leading teams and understanding that each individual comes with uniqueness.
Hmm.
So through my career, I have found that mentorship, that approach of allowing somebody to find their own resources and resiliency and things has really been a value for them.
Hmm.
And so, in about 2018, I decided, I knew in retirement I was going to want to be a coach, and
Right.
but I needed to go to school to figure out what that really meant, and I'm a big believer in educating myself on topics and what I need to learn. And so I went to school and I started plugging away at it on the side while I was working, and I took a gap, and did some private industry work and was able to coach teams in a startup to decide what they wanted their new business to look like. And so I think it's come a little bit naturally to me. And now I've had to shift from a mentorship approach to a real coach approach, which is different. Um, but when you actually get to see the people you're leading or the people I now work with break through and have light bulb moments because they have found their own internal resilience and resourcing in their own answers from some good questioning, it's extremely rewarding.
It is, isn't it?
Yeah.
Yeah, that's amazing.
Yeah.
I'm curious about something you just mentioned, that you're at a very different place now, and
Mhm.
that you have a sense of gratitude. And the story I'm making about that is that there probably were some developmental days, some difficult days or harder days.
Mm.
What is something that you would say to the earlier version of yourself that is in that role right now, that you'd love to have been able to be told when you were there?
Wow, what a great question. And what I would say to her is keep networking, keep asking good questions of your colleagues, of your supervisors, push the boundaries a little bit respectfully, and it's going to be okay.
Yeah, this too shall pass.
Yeah. And it's really hard to see when you're in it.
Right.
And I think the other thing I would say to her is pause, take a breath.
Hmm.
It's really important that you're looking after yourself. And we know we talk about it all the time. It's out in everywhere you look, LinkedIn, Facebook, Instagram, doesn't matter. Everybody's talking about breathing and pausing. And I'll tell you, in healthcare, we really, really need to learn that.
Right. Yeah, I
Really need
agree.
to learn that. When I'm on
Yeah.
vacation, I'm actually on vacation. I'm not checking emails. I'm not
Right.
checking in. We need to support our teams to soar themselves when they're covering for each other,
Hmm.
and allow them to make mistakes. There's always people to support them, but really breaking, for all healthcare leaders, doesn't matter what level you are, doesn't matter if you're direct care up to the CEO, the
Hmm.
break has to happen in order to maintain your resilience.
Yeah.
We know that really hard to do.
Yeah, well, even elite athletes, or not even elite athletes, know that their rest time is just as important as their practice or their training. And so, why wouldn't we need that in the high stakes world of healthcare? Like, we do need that. And yet, there's this part of me, playing the devil's advocate a little bit. The first question, if I'm in the trenches, so to speak, is how do I do that? And so, what would you suggest for the leader and for the let's just talk to the leader and then the clinical leader that is reporting to that person, and they're in a department that is so overwhelmed right now that they don't even have time to pay attention. They don't feel like they have time to pay attention. They don't feel like they can take a deep breath. So what would you suggest to those people, and why is it important to take that pause in that kind of a circumstance?
Yeah. When you're in it, it's really hard to see and it has to take small shifts. And, I've got a course, the enrollment's closed for this May now, but we're launching again in September. And it's really about revolutionizing ourselves and really setting boundaries. But it takes small shifts now to unlearn previous behaviors we've put in place to relearn there is a new way to move forward.
Mhm.
Um, simple things like I'm going to take a lunch break from 12 to 1 every day, and or 12 to 12:30 or 12 to 12:15. Small achievable chunks that I'm going to just go in my office, shut the door, not look at anything, eat my lunch and just be quiet. We need the quiet space. So, it really is about intention and focus. And of course, I'm biased. Executive coaches, leadership coaches can support people to learn how to do that in a real intentional way.
Mhm.
And it can work, but it takes intention. So just like the athlete you referred to has to practice and practice and practice, these skills we're trying to unlearn and relearn, we have to practice and we have to fail and we have to get back up.
Mm. Yeah, I see it as being a new operational priority, because if you have these things in place where you do slow down, they're definitely you're going to see a net result. And I know you have in your leadership and also with your clients. And I've also seen that as well. One of the main ingredients to that is the idea of a safe space. And
Mm.
psychological health and safety obviously is a big topic in Canadian healthcare. What are your thoughts on psychological health and safety, and especially how do we operationalize it? Because I think that there's lots of people talking about it and we talk about things a lot, but
Yeah.
I think it becomes real when we can feel it and when we're actually practicing it and embodying it. So what are your thoughts on psych health and safety and how a leader and a team can actually begin to practice with that?
Yeah. This is probably gonna maybe poke a little bit. Psychological safety only happens when the individuals who are in the team can show up with emotional intelligence and produce and be productive within that team.
Right.
So when people talk about psychological safety, yes, we all need it and want it, but we all have an individual responsibility to show up into that space
Mhm.
and know about emotional intelligence and how do I show up and either push back or engage in a way that is respectful, that allows for the psychological safety. So it only takes one person who shows up and doesn't understand emotional intelligence or an approach that can break a already psychologically safe environment that is no longer, it becomes no
Right.
longer quickly.
Yeah, you're tapping on a huge pervasive problem in healthcare right across Canada and probably around the world. And this idea that there are some sort of what I would characterize as potentially disrespectful or somewhat toxic people, and people get labeled with that. And so for me, I love psychological health and safety from the perspective as it being top down, but there's this other facet that I'm studying right now in my graduate work and also in my work in the world, and that is neurobiological safety, or what Dr. Porges would call polyvagal safety. Because
Yeah.
to your point, I think a lot of the time the reactiveness that exists in teams or the toxicity might be sort of on top of a very dysregulated neurobiology where that person's not even aware that their body is in fight, flight, freeze, and instead they've got this narrative on top of that. And so I wonder what you think about that, and what we might do to create a space where it really does feel safe in our nervous system.
Yeah. Oh, I love where you're going. I talk to my clients and the teams I am working with all the time about the neurobiology, and our systems are, I would say, probably a big portion of the world is working in threat all the time. And which means we can't get to the prefrontal cortex of our brains and we're staying in
You
the
got it.
amygdala. Right. So we're in fight or flight all the time. And we actually need to be able to do that when as everybody knows, the big tiger's in front of you and you need to run. But that tiger can also look like I go into a space and I'm not sure my boss likes me, or I go into a space and I don't think my peers respect what I bring to the table, puts you automatically into a level of threat, which then doesn't allow you to think straight.
Right.
So, love what you're saying. I think we need to be talking to people about how do you regulate your emotions, but also slow your system down, which we talked about earlier in a different way. But now we're getting into the biology of it
Right.
and helping people understand that it is biological. So we actually, as individuals, need to understand the feelings we get in our system. My blood pressure's going up. My armpits are sweaty. I'm getting
Right.
red. My shoulders hurt. My gut hurts. Those are all triggers or alerts for us to know our nervous system is probably not where it needs to be in order to engage.
Mhm.
So when you talk about a psychologically safe environment, as individuals, if we aren't in tune to that and we come into a space in a level of threat, we can't participate and possibly will make that environment not safe for others.
100%. I actually wonder if, and this is where my thesis is going, is if that is a feedback loop systemically for individuals to pay attention to
Mm,
become a system input. Firstly, doing the work inside of themselves that needs to be done to self-regulate, like you're talking about, but also to be aware of their neuroception. I love what Dr. Porges talks about this with polyvagal theory, because neuroception is this system under the hood that we're not aware that's there, that's
right.
constantly gauging for threat or safety all the time, and it's an autonomic system. So you can't think your way out of a dysregulated body. You actually need to do something physically to slow down and notice that the narrative on top of that neuroception might not be accurate. And he even talks about this, where we begin to perceive reality in different ways than it actually is because of accumulation of stress and distress that's going on. So what fascinates me about this is, and I'm curious what you think about this part systemically. We talk about systemic work all the time like it's external. What if we are the system, and the work that we do inside of each one of us and then collectively in a team is actually the system input we need to transform healthcare, to change it in a fundamental way, and that the individual gets to be at the top of that list to take care of themselves, and it also serves the collective as well. Obviously, I'm geeking out a little bit now because that's kind of what I'm studying right now in my graduate work. But what do you think about that idea? Have you experienced that, or do you have a different take on it?
No, I think you're headed towards what some of what I believe is, if we aren't grounded in and looking after ourselves first, we can't actually be part of a team in a really, really healthy way, which is part of the system. So the individuals, all of the people that go into healthcare as one system, and this isn't just healthcare related, is what I would say to you, um, are part of the system. They are the system.
Right.
So the piece about recognizing, how do I get to the tables in a way that is regulated and um, slowed down enough that I can participate in a productive way, or I know I need to exit and come back.
Right.
The Neuro Leadership Institute talks about 3 levels of threat, right? They talk about the first level, which is actually motivational, right? We need to have a little bit of anxiety at times if we're writing an exam. It's not bad. That's just part of our biology triggering to us that could actually be excitement. The level 2 threat is, I've kicked up a notch and I actually need to pause. So don't respond to that email right now. Maybe step up and take 5 minutes. And then there's level 3 threat, which is actually, okay, break. I'm shutting down. I'm going outside. I need more time to actually break from the environment I'm in. And I think when we can understand those things in our own selves, as you've articulated, we are part of the system.
Mm-hmm.
And
Mm-hmm.
so if individually we can get to that place, with our teams are going to be much stronger. And I
Mm-hmm.
know that sounds pretty lofty. And there's going to be people that listen to this and say, no, the organization needs to do this. My leader needs to do this. We all have a part.
Yeah, I think the organization definitely has a part, but it might not be the same way we've had it be in the past. Like we have to develop a new system of leadership and support organizationally that may support a group or a team to actually create the space we're talking about. Because to your point earlier about sort of constraints operationally and time, if a team and a leader doesn't create time in the calendar for this, it's not going to happen. And so, what if that was a priority? I also think that what you're saying about this affecting all other systems is really true too. It's been anecdotally true in my experience that my family system is definitely affected by my nervous system and by my work system. These things are all integrated, and it kind of gets back to presence. How I show up has a huge effect. What I wonder about is, we're talking about something that asks us to develop some pretty substantial consciousness and awareness. And I don't know how you've developed yours, but I know most of mine's been developed through a lot of pain and a lot of trial and error and mistakes and frustration. And so I wonder what we can do to help others to maybe not have to go through as much pain. What kind of things do we need to do to create an environment where that kind of awareness you're talking about can happen, where somebody can go, yeah, I'm a level 1, I'm a level 2, I'm a level 3. Like, what does that person need to do to develop that, do you think?
Yeah, I'm not sure you can go through it without a little bit of pain, to be honest, because it's a learning journey.
Yeah.
Just like going through a master's of education, or there's pain through things. And again, how you interpret that pain and bring that pain in and move through it is part of how we build resilience. And we all have a different level of capacity for that. Um, So I think the question you asked, though, really is about how do we as leaders support our environments to be able to allow people to have that space to do the work. And I think we just have to be real and authentic. And
Hmm.
we have to understand ourselves enough to set the space and the time to allow our team members to take what they need to do that. In chaos, that can be hard, and it's totally doable. And it is
Hmm.
relational. And I like to talk about connection before content. Are we actually getting to know who we all are as human beings when we're coming to a table that we might work together, might have worked together for years? There's always things going on in people's lives. We actually need to connect. We're human beings. We're driven for social connection. So I think we need to be resetting our tables, allowing for some connection up front before we get into content, but also getting through those, I'll call them meetings because there's many of them. Are we meeting for the right reasons?
Right.
And what's the outcome we want? My experience has showed me that due to the inability to make decisions, sometimes in meetings we end up having another meeting. And then we have another meeting. And so again, that comes back to opening the gap and letting people work to their scope of practice, that they've been given the accountability for, and getting out of the way for that and supporting from a different way from every level. So it's so complex and multifaceted that I think the only place we can start is with ourselves.
Mm. Yeah, I agree. And I was just thinking about Daniel Siegel's window of tolerance, where, the diagram has in the margin there. It's really helpful to have a space holder do this with you. There's this sense of self-regulation and co-regulation that can happen together. Our nervous systems are sort of built for that. I wonder what would happen if that would be a prioritized line item on a meeting agenda, where we're actually all slowing down, like you're mentioning, and regulating with each other, co-regulating with each other, and then taking a step that is maybe a little bit more informed by something different.
Yeah.
um as you are kind of navigating your work now, I'm curious, just as we come to a close now, you said earlier one of your passions or missions as an organization is to help healthcare leaders to stay in the game, to be there, and to stay engaged in healthcare. And we, of course, have a huge, I would say it's a crisis on our hands with people leaving healthcare and really, maybe even out of survival, leaving it as a occupation. I'm curious what you would tell those folks that have left or that are thinking about leaving, that would be important from your perspective for them to know.
So get help, whatever that looks like, is the first thing. So is that do you need some counseling? Do you need a coach? Is it a friend? Talk to somebody about what might be going on for you. The second piece is the break. Take your vacation, and actually take it. So when I talk to leaders, and I used to do this with my teams, don't let me see you online in your vacation. I actually, as your leader, need you to come back refreshed because of the day to day.
Mm-hmm.
If we don't ever break, it's really tough to stay in the game. So I think the biggest thing for me is it's about breathing. It's about
Mm-hmm.
slowing down enough. And I know that's really hard and it takes practice. So you've got to practice.
Yeah. Yeah. Thank you so much for that. Now, Suzanne, how can people get in touch with you, and what have you got coming up? You mentioned a course coming out in the fall.
Mhm.
And what are you working on right now that you'd love people to know about, and how can they get in touch with you?
Yeah, so Foxton Consulting is my website where you can find all about me and connect with me if you're interested in executive coaching, particularly, but also two courses rolling out in the fall. Revolutionizing Yourself is one of them. So there will be fall dates. They're just coming down now for this cohort that's going to be starting, but we'll have new dates coming in the fall, which is really about self work and driving habits and really understanding what's going on for me as an individual. So that's a 3-month program. The second one is getting good things done and navigating politics in an organization with integrity.
Wow.
Really excited about that one. I've just sold out the first cohort, so we're going to do a second cohort as well in the fall. So yeah, check out my website. I'd love to connect with anybody who's looking for a guide by the side for
Wow.
themselves or their team.
Suzanne, thank you so much for the work that you're doing in the world and for being here and being generous with your time. Thank you. And we'll look forward to the fall and what you're going to bring.
Thanks for having me.
All right, that's the end of our show. Thank you so much for spending your time with us and being with us. And by all means, reach out to Suzanne and let her know on LinkedIn or through her website what it is that you got out of today's podcast episode. And I hope and trust that you'll be able to take something actionable from our time together and apply it where you work. And as you leave here and you go into your work in the world, remember to be a safe space. We'll see you next time. Thank you again for getting to the end of this podcast. And if you enjoyed this and you found that there was value in it for you, my invitation is for you to subscribe for future episodes that come out weekly on Tuesdays. Thank you again, and I'm looking forward to being with you next time. Now remember to be a safe space.